Today's panel that we have is a really well-rounded panel, and we're going to discuss mental health, substance abuse issues.
So what we decided to do was spend the rest of our lives to save and spare other parents the grief that we suffered from losing a child from a totally unpreventable death from a drug overdose.
In 2019 and 2020, the drug overdose death rates were higher for American Indians and Alaska Native people throughout the United States.
If we show people enough kindness and love and just help them out and treat them each as individuals, as people that are deserving of respect, deserving of kindness. I see, as I've been doing this now for all these years, so many people feel unloved, they feel discarded, they feel like, and they've been told that they're trash.
The opioid crisis is the most deadly drug threat our nation has ever faced, ever in the history of our country. It's the #1 killer for adults from the age of 18 to 45. The #1 killer in America is drug overdoses.
And the work that Victoria's Voice is doing is, again, it's of paramount importance. All of the activities that you do, the educational programs, the monies that you provide, the education, all of that stuff is very important. And I want to thank you again, Victoria's Voice, for being there for families, for being there for communities, and for being there to help abate this opioid crisis and this drug issue that we have in our country.
You can't find a family, it's hard to find a person who doesn't know someone who has been affected by the opioid epidemic, someone who has died from a drug overdose.
It's through the Attorney General offices and foundations such as Ms. Siegel's that we are able to disperse that throughout Indian country and the state of South Carolina.
Passed away, $100 million home. It didn't mean anything because all that money couldn't bring her back to life.
What mattered most was stopping the senseless, avoidable deaths from a drug overdose that was wiping out our future generation.
I should have been walking her on me. It should have been me laying there, not her.
They founded Victoria's Voice Foundation.
We've saved, in the last year, thousands of lives through our efforts. We're going to save thousands more.
The foundation took what caused her death and built extraordinary programs around it.
I am so thankful that David and Jackie Siegel made the leap to take a personal experience and turn it into a moving, successful, life-changing organization.
This is an epidemic, and I don't know why we're not talking about it. It's just so critical. It's about our kids.
I will do all that I can in our state to make sure that there are no more Victorias. Nobody should have to go through that anymore.
To prevent parents from missing the signs, Victoria's Voice created a powerful education program for parents called Vital Signs.
She had no coping mechanism. The only thing she knew was what she always knew, and that was drugs.
To address the lack of coping skills that led Victoria to turn to drugs, the foundation developed engaging youth programs and sent speakers to schools in most U.S. states, to hundreds of schools that has now impacted over 1 million lives. To get their programs distributed across the nation, they organized forums, created partnerships with grassroots organizations in all 50 states. Now bringing the message through the pulpit with a network of 17,000 pastors, 25 denominations in 50 states.
I'm reading the book right now, the Victoria's Diary.
This is going to be a very, very helpful. I believe God's going to use this.
Most of the deaths that are represented in this room could have been prevented if a naloxone was available.
To ensure that we don't lose another life because there is no naloxone when an opioid overdose happens, Victoria's Voice led an awareness campaign.
According to the CDC, more than 50% of the people who overdose in proximity to another person. They're just not equipped to render aid because they don't have access to Narcan.
The foundation also secured a bipartisan federal resolution designating June 6th, the day Victoria died, as the National Naloxone Awareness Day.
Thank you for supporting the introduction of a bipartisan resolution to declare June 6th as National Naloxone Awareness Day.
Then launched the Get, Give, Save campaign, or Get Naloxone, Give Naloxone, Save a Life, on November 1st to make naloxone a household name, to fight the fentanyl poisoning crisis. Provided GGS toolkits to major county sheriffs with 130 million constituents. Joining forces with media and retail establishments to get the word out to thousands of lives have been touched and saved in barely 3 years that the foundation has existed, working with partners in both government and the private sector.
It took a community, folks. It took us working with UFC, the Raiders, the Siegels. It's wonderful.
David and Jackie can no longer do this alone. There is a reason you are seeing this video today. We need your help to save the next generation.
Get, give, save.